Hello friends, today we are going to discuss about World Health Day 2022. I'm Dr. Suresh Badadmat, Professor of Psychiatry, working at NIMHANS, Bangalore. Every year on 7th of April, we celebrate World Health Day. This is the day when World Health Organization gives a theme annually to focus specific attention on health topic of concern to people all over the world. This year's theme is Our Planet, Our Health. We need to clean our air, water and food. That is #Healthier Tomorrow. This is the theme. The theme means without having a healthier planet, we are not going to achieve our health. That means well-being of the planet is essential to have everyone's well-being. This year, World Health Organization has clearly focused on to bring attention about the interconnectedness between the health and our planet. Imagine if our planet is not healthy, how can you be healthy? Simple, if the air pollution is there, how will you be healthy? If there is a water pollution, how can you be healthy? Because without our healthy planet, we cannot be healthy. World Health Organization estimates 13 million deaths around the world each year because of avoidable environmental crisis. This includes climate crisis, which is the single biggest health threat facing the humanity at this point of time, my dear friends. That means we need to act now. Climate change is expected to cause approximately 2.5 lakh deaths per year from malnutrition, malaria, diarrhea, disaster and health stress. What more we are going to expect now? That means environmental change is occurring. Climate change is occurring and it is having direct impact on our health. The direct damage cost to health is estimated to be between somewhere around $2 to $4 billion per year. This is by 2030. This is an estimate I can tell you. Hence, the World Health Organization has urged to focus the global attention on urgent action needed to be taken to keep the human and the planet healthy. That means we need to make sure our planet is healthy. It is inhabitable. That means every human can stay there. Otherwise, even if the human is going to stay there, that means he will be ill health. The climate crisis is also a public health crisis and an environmental crisis, leading to well-being crisis of every citizen on this planet. As per National Center for Environmental Health and Center for Disease Control and Prevention by US, which clearly brought in this important concept of how climate change impacts our health. Climate change such as floods, hurricane, avalanche, heat stroke, heavy rains, flash floods can cause severe weather problems, extreme weather, air pollution, water pollution, drought, difficulty in getting food, food scarcity, extreme heat, change in vector, ecology, increasing allergens, scarcity of food and water. This will have direct impact on health. This leads to forced migration or food scarcity causing malnutrition. Poor water quality can cause various communicable disorders. Increased air pollution can cause respiratory allergies and asthma. Change in vector can cause malaria, dengue, encephalitis, name the disease. Now, as we know, COVID, further air pollution also causes asthma and cardiovascular disease. Mental health impact is direct. Other health-related problems are known to occur. My dear friends, climate change is real and its impact on health is also real. Let's look into the variables playing a role in climate change and public health. As you see, this was given by World Health Organization. The climate change acts on two important factors, vulnerability factors and exposure pathway. What are these vulnerable factors? Where the person is living? What is the age of the person? They are all demographic details. Geographic factors. Where is he staying? Is he in flooding range? Is he in the place where landslides are common? What are the biological factors? How his genetic makeup is? Socio-political conditions and socio-economic factors. Whether After the disaster or climate change, can he bounce back? Does he have enough of resources and resilience? These are all vulnerability factors. If there is vulnerability factors and he is exposed to a climate change, such as extreme weathers, heat stress, air quality, flood, poor water quality, food security is less, vector-borne diseases, this leads to definitely diseases. If there is a disease, do we have a good public health system? That is an important question need to be answered. Do we have adequate number of beds, adequate number of doctors, nurses, medicines? Are they available? Do we have a good access to these public health systems? Whenever there is a flood, that means access to healthcare becomes very difficult. We may not be able to give medicines to each and every person because they are caught in the floods or maybe in the hurricane. That means we need to have a robust, climate-resistant and resilient health system. Otherwise, we will have poor health outcomes such as injury, morbidity, mortality, heat-related strokes, respiratory illnesses, waterborne diseases, communicable disorders, non-communicable disorders, vector-borne diseases, malnutrition, name them. That means it will have a severe impact. We need not have a war at all. We are already waging war against the environment. And in one stroke, the environment is going to destroy us. That means it is going to destroy by not providing clean air, not providing safe drinking water, rise in temperature. And if there is a drought or an extreme temperature, can we be able to grow vegetables? Will we be having access to secure shelter? So those are the important factors which have been highlighted by World Health Organization. So we need to curtail this global warming. And indeed, no temperature rise is safe to humans. At this point of time, we are all already at the tipping point. In the past 20 years, heat-related mortality among people aged above 65 has increased by 50%, my dear friends. High temperature have brought increased dehydration, poor renal function, skin cancers, tropical infection, adverse mental health problems, pregnancy complications, allergies, cardiovascular and pulmonary problems have been highlighting at this point of time. That means we are in a fragile ecosystem, my dear friends. Planet's biodiversity loss is happening every minute, and it is occurring at the unprecedented rate, impacting every human across the planet. This increases the rise of both communicable, non-communicable, and various disaster-related health problems. COVID pandemic has shown us that we are in a very fragile ecosystem. We have an abysmal public health system. We are not investing in our public health. And this is going to affect us very badly, my dear friends. Unequal access to healthcare, unequal access to scientific technology advancement. This will accentuate the public health issue. And this will have a severe impact on vulnerable population. Who are these vulnerable population? They are children, elderly population, pregnant women, ethnic minorities, people from poorer socioeconomic status, persons with disability, people with already underlying health condition such as malignancies, hypertension, diabetes, asthma. Those are the people, they will be hit very bad whenever there is a climate change. As per the Intergovernmental Panel on Climate Change report shows that every fraction of a degree hotter endangers our health and future. Not only that, our planet is under danger, my dear friends. Every action taken to limit the carbon emission and global warming brings us closer to a healthier and safer future, my dear friends. So what can I do? What you can do? What every citizen on this planet can do? Every person should become aware of the climate change, and they need to know it is the biggest health threat for the humanity at this point of time. Focus needs to be on ecological well-being and individual well-being. What is this ecological well-being? It is the planet's well-being. That means the planet should have a good climate, good environment. That means that will help the human beings indirectly. That means if you want to have a individual well-being, that is directly contingent upon ecological well-being. We need to break the cycle of environmental destruction of the planet, deforestation, and also pollution. This requires legislative action by every country. They need to have a corporate reforms. Individuals need to be supported and incentivized to make a healthy lifestyle. We need to reduce the use of plastics. We need to reduce carbon footprints. We need to reduce pollution. If we are able to do this, we are going to have a healthier future. Although it is unequivocally clearly said that climate change affects the human being very badly, both in mortality and morbidity, but it remains a challenge to accurately measure what is the impact of climate change. For every 0.1 degree centigrade of increase in temperature, how much it affects the human population, we are accurately measuring is becoming very difficult. But however, we grossly know that climate change is impacting the health across the world. Hence, health professional needs to raise voice, need to advocate against climate change, and need to raise voice against the inaction by the government. That means it is the duty of every citizen to wake up our government. We need to say, come on, climate change is real. As a health professional, we must. And we need to aid the transition to a sustainable, fairer, resilient and healthier world. We need to tell every citizen to choose a healthy lifestyle. We need to urge the government and other leaders to act against the climate change and invest in resilient health systems. We need to target the targets to reduce carbon emission. We need to conserve biodiversity. These are welcoming, but they are not enough. We need to be matching with the credible short-term and long-term outcome plans. They need to be clearly laid out across the world. Every country should strive to biodiversity conservation and reduce global warming. Many governments met the threat of COVID-19 pandemic with unprecedented funding. Health funding increased. Similarly, currently there is an environmental crisis. Similar emergency response need to be there. Emergency funding needs to be there. Otherwise, it will be too late. Huge investment will be needed beyond what is being considered or delivered anywhere in the world. But such investment will produce a huge positive health and economic outcomes. And the future for our children will be brighter. Public health systems are the main first-line defense for population against the climate change, against the emerging health problems, against the disasters. That means we need to have a robust public health system, my dear friend. We need to increase the access to healthy food, access to healthcare, encourage physical activity. We should limit unhealthy food. We need to tax them. We need to reduce the industrial marketing of packaging food because indirectly they are polluting the environment. Not only that, they are polluting our health also. We need to decrease our carbon emission. We need to protect our biodiversity. Not only that, every country, every state should build state-of-the-art public health system in every city and every village. We need to decrease the widening health inequalities. All countries should build climate-resilient health systems that need to be at the primary healthcare level, at every village, at every last person, last mile should reach the good health care. To conclude, my dear friends, countries that have disproportionately created this environmental crisis, they are all developed countries. They are the people who have exploited our environment in the name of industrialization. They need to act first. They need to act fast. They need to act now. They need to support low and middle income countries to build a cleaner, healthier and more resilient society. There is a huge responsibility on the developed countries. At this point of time, these developed countries preaching the developing and underdeveloping countries. Those industrialized developed countries have a huge responsibilities on their shoulder. They need to act now. They need to stop preaching. They need to do some action. The majority of the countries identify health as a priority sector vulnerable to climate change. But there is a huge financial gap remains that needs to be immediately addressed. That means we need to invest in our future. Without investing in our future is very bleak. Funding must be equally split between mitigation and adaptation, including improving the resilience of our health system. That means prevention and promotion, at the same time therapeutic purpose by building a very good public health system. As you see, to conclude, my dear friend, the climate change, the environmental change has direct impact on the genetics. This further leads to what we choose. That is the lifestyle. What kind of lifestyle we are going to choose? What is the diet? Whether we are choosing a healthy lifestyle, unhealthy lifestyle, stress, deforestation. This will lead to environmental change, global warming, water pollution, air pollution, food scarcity, drought, flooding, disaster. This will lead to illness. If you choose wisely healthy lifestyle, good forestation, reduction in stress, will have a good air, water, food, that leads to wellness. That means you need to protect your environment. Environmental wellness is very essential for human being wellness, my dear friend. Hence, this year theme is Our Planet, Our Health. That means it is the duty of every citizen not only to look into our health, but also to the health of our planet is very essential. Hence, we need to clean our air, water and food. Hence, #Healthier Tomorrow is the theme given by World Health Organization. Thank you very much for giving your valuable time. Stay safe. Remember this, our planet, our health.